I'm going to tell you 3 scenarios in which my patients are able to lower their blood pressure quickly. I mean, often super fast, even within minutes. And we're talking naturally, by the way, not with the use of medications, but they do it on their own. Guys, I'm Dr. Jen Caudle, practicing family physician. All right, let's begin. First scenario is when my patients come to my office, or rather to the exam room to see me, they typically have to walk a little bit of a distance. They've got to get from the waiting room to the exam room. They've got to go through a couple of doors. They got to walk through a corridor. They finally get to the exam room. Now, if I put a blood pressure cuff on my patients immediately, I can tell you their blood pressure would be pretty high. And that's often what happens when my staff or myself do that, okay? But in that scenario, my patients are often able to lower their blood pressure very quickly if they do something very simple. And that is if they take a moment to sit down, to relax, to take a couple of deep breaths, and to allow their body to settle in. Remember, that walk from the waiting room, their heart rate has gone up, they're ambulating, they might be a little short of breath depending on whatever underlying conditions they have. There's a lot of things going on, and it's not uncommon for blood pressure to be higher simply because you've had to walk a little way, or maybe you've been rushing to get to the office, and so you're kind of hyped up. So in that situation, lowering your blood pressure from an elevated state, if it's checked right after you get into the room, sometimes can be very simple with relaxation, with sitting quietly, sitting still, taking a moment. And what I would say too is if this is you, don't hesitate to ask the staff or the doctor, hey, would you mind just checking my blood pressure in a few minutes? I've been walking down the hall. I think it's going to be a little bit higher than normal. That's a very reasonable request that I hope your doctor or healthcare providers entertain, okay? So that's the first scenario. The second scenario is anxiety, okay? How many of you get anxious when you get to the doctor? Or maybe you get anxious when even thinking about going to the doctor. By the way, this is so many people. I have patients that start getting anxious 2 weeks before they come to see me. It's just part of who they are. By the way, I have videos on how to deal with anxiety at the doctor's office. But if this is you, this literally can shoot your blood pressure sky high, okay? Not only are you walking down that corridor, through the doors, etc., to get to the exam room, but you are super nervous. Maybe you don't know what I'm going to tell you. You don't know what your lab results or your test results are. Maybe you just get nervous for no identifiable reason. Well, let me tell you what allows many of my patients in this scenario to lower their blood pressure within minutes super quickly, okay? And yes, often when I'm checking their blood pressure, they get into the office and they're anxious, it's sky high. But what often helps is a little bit of mindfulness and meditation. Also breathing exercises. Let me tell you, I've got some videos on breathing exercises I will link here, but taking a moment to take a few deep breaths, to do some breathing exercises, to have a couple of moments of silent meditation, some mindfulness, literally can help center you, help you feel more grounded and centered so that your anxiety is less, and thus often, or rather more likely, your blood pressure will be lowered on recheck, okay? Guys, by the way, these techniques often lower blood pressure literally within minutes. I have seen it. I've been in practice for over 15 years. I have seen it a lot. The first scenario, just resting, can do a world of difference for people. Second scenario, mindfulness, meditation, breathing exercises can be so helpful, okay? Now the third situation, all right, what are we talking about with the third situation? Third situation, as a family doctor, a lot of times people get upset in my office. Not necessarily at me, although I'm sure that's happened. But, if we're talking about something going on in their life, if they start becoming tearful or sad or upset, or maybe mad or angry, any of those emotions, those powerful emotions can also be very powerful and do a powerful number on our blood pressure. Being tearful, being sad, crying, being upset can shoot our blood pressure way up. And if you have these emotions in the doctor's office, well, your blood pressure can go sky high simply because you feel this way. So a quick solution for this, although sometimes it's not as easy as the others, but it's really trying to center yourself once again, like we talked about in the last scenario, but also just literally trying to calm down. to try to settle your emotions. If it's anger that you're feeling, to try to, whether it's mindfulness, breathing, exercising, meditation, etc., to center yourself so that you don't feel the anger so much, so that you don't feel as sad. Changing your emotional state, which is not always easy, but can work very quickly. Changing your emotional state can literally lower your blood pressure very, very quickly. Now, in all these scenarios, these three scenarios, I'm talking about people who generally their blood pressure is not as high as it shoots up to when these scenarios are in play. Okay, I need to say that. Okay, if your blood pressure lives way, way up here, your goal is not going to be or shouldn't be to lower your blood pressure acutely. You want to lower your blood pressure for the long haul. You want to keep your blood pressure low and lower it consistently and maintain that, which is a little bit of a different topic, by the way. And I'll tell you a few tips for that. We all should be striving for a normal blood pressure that stays pretty stable and normal all the time, okay? These scenarios are really for people whose blood pressure spikes, and we try to lower it because of these scenarios. I don't know if you heard that, but it's like a lot of noise outside. Sorry about that. So a couple of things, though, and I'll link some other videos on how to keep your blood pressure or lower your blood pressure naturally without medications and to kind of keep it that way. Suggestions are eating a healthy diet, minimizing the salt in your diet. And by the way, guys, this means no salt shaker, but also minimizing processed and prepared foods, which tend to have a lot of salt in them naturally. Not smoking or quitting smoking if you do smoke. Making sure that you're exercising. If I didn't say maintain a healthy weight, I want you to do that. Also minimizing alcohol. And I've got other tips. Those are ways to keep your blood pressure low for the long haul, which really should be our overarching goal for all of us, okay? But remember, if you get these different scenarios, you need to kind of calm yourself down, get your blood pressure in check because it shoots up. These are some tips that very well might help. Take a look at my other blood pressure videos. And I should also say, lastly, okay, of course, as physicians, we are able to bring your blood pressure down with medications. We often do that in the hospital setting. We sometimes do it in the outpatient office setting as well, okay? I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Let me know what you think about this video. Please share this video with someone you think could benefit from it. Let me know if you tried these techniques yourself and how they work, or what you do to lower your blood pressure quickly. There are likely other suggestions as well. These are just 3 common scenarios I see that really work for my patients. On Facebook, please like and follow my page. On YouTube, please subscribe to my channel. Click the little bell for updates. I do daily health videos. Guys, also make sure you check me out on TikTok, on Instagram. I also have a WhatsApp channel. I'm on Threads, X, you name it, at Dr. Jen Caudle. And you don't want to miss out on this last one. I actually have a free health newsletter that comes out weekly, so you don't miss a video and things like that. You want to make sure you go to my website, drjencaudle.com. You can also learn a little bit more about me and see a few other things and have access to this free health newsletter through my website. So check it out. Guys, I hope this is helpful. Let me know. I'm Dr. Jen. I'll see you soon.